How has COVID impacted the mental health and emotional well-being of children and adolescents?
Sure. Well, thank you for this opportunity. COVID has worsened the children's mental health crisis, but this was a crisis before COVID. We know that 1 in 5 youth are in need of mental health services of some kind, and 77,000 children in Minnesota alone will experience the death of a loved one. So for that's an ACE, an adverse childhood experience. And we know that 92% of educators say childhood grief is a serious problem. And we have seen COVID worsen both grief and mental health situation for children and young adults. It's worsened it. So we in 2020, emergency room visits went up as much as 30% between 12 and 17-year-olds for 12 and 17-year-olds. And during the pandemic, nearly half of students felt persistently sad or hopeless. So we've seen those feelings increase. We've seen suicide ideation, which is the thinking of suicide. We've seen that increase as well. Those are stats from studies, but we have reports from emergency rooms that they're seeing increased mental health visits. We know from fire departments and police that 911 calls have an increased percentage of mental health a mental health situation with those. Now that's for all populations, not just youth. And then in my work, I work sort of in between education and healthcare. And so we hear, and I'm sure the psychologists can tell you this too, is that the school staff are saying they're seeing increased need and increased requests from students and parents and families for more mental health support.
What would you say is a really good definition about what is a mental health?
Mental health is it's multifaceted, right? So it's our psychological, our social, and our emotional well-being. So mental health really impacts so many different areas of our lives. So it impacts like how we experience the world, how we feel about things. It impacts our relationships. One thing that I think about is having positive mental health doesn't necessarily mean that you're happy all the time. And I think that's sometimes something that we believe, like as a society, that if you are mentally healthy, then that means that you're happy and everything is going well. It actually doesn't. So it means more that you feel a sense of balance in your life, that you have a sense of well-being. You have the ability to form healthy relationships, right? Doesn't mean that always your relationships are healthy, but that you have the ability to do that. And I think most importantly, you have, when you're mentally healthy, you have the confidence to kind of face life's challenges. You feel like that you can kind of handle the things that life will throw at you.
Besides the pandemic, what else has been reported as the contributing factors to mental health crisis among children?
Well, because of COVID, it's the things that COVID sort of did to us, if you will, and did to our kids. It's the things that happened from the spring of 2020, which included, closing schools. Kids were experiencing lack of contact with friends and extended family members. And with that, you get these loss of milestones, graduating high school, for example. Excessive screen time is in there, and lack of supervision.
So, Kara, what are typical concerns or reasons why someone might come and see you or see a clinician?
Sure. So I work with kids and adolescents. And so there are a lot of different reasons that parents, and it's usually the parents, seek out behavioral health for their kids or their teens. Sometimes it's really easy to identify reasons. So sometimes kids are having behavioral struggles, or are appearing really anxious or worried about different things. Maybe are sad and crying a lot. And so sometimes it's fairly straightforward. There are really kind of concrete reasons that parents are concerned. And other times it's a little bit less easy to define. So it might be, kids or teens come in because they're struggling at school, but we can help kind of identify what might be getting in the way, or what really are the difficulties at school, whether it is academic or is it more kind of emotional or social concerns. Sometimes people will bring kids and adolescents in because there's some stressful situation. So, I mean, we're talking about COVID. That was obviously a stressful situation for all of us, right? And so kids struggled more, especially during the height of the pandemic. Sometimes it's family changes. So if there's something stressful going on in the family, we can help kids kind of process what's going on. So in terms of how people access our services, so we provide, across our behavioral health team, we provide mental health services to kids, adolescents, adults, families, right? So we kind of cover the whole gamut, but all who are already patients of Park Nicollet and Health Partners. So we serve the patients of Park Nicollet and Health Partners. In terms of how, a parent might go out or might be able to access our services, or access any behavioral health services, I should say, I would recommend first talking with your pediatrician or your primary care provider, because they should be able to give you some recommendations for places you could go. You can also call your insurance company, because they should be able to give you good ideas of clinics that you could go to, but also which ones are covered by your plan, which is important. And then I'd also encourage people to use the resources at schools. So often, if there are difficulties that are impacting your child at school, make sure to communicate with school staff, with the teachers, and whoever you can talk to at the school, to make sure that they know what's going on too, because they have some really great resources.
What is Park Nicollet doing around services that are school-based, and understanding that that this is the Park Nicollet Foundation is the philanthropical arm that is providing support to these programs. And so, Abby, can you talk a little bit about the Now program first?
Absolutely. So the NOW program, or as you've heard it called a few times now, stands for No Obstacles to Wellbeing. Currently, we're involved with 3 schools in the metro area. So specifically, Burnsville High School is the school that I work with. We also work with St. Louis Park Middle School and Richfield High School. And at each school, we have 10 to 12 therapy slots available for different students. These are going to be students who don't have insurance. They don't have parents who would be able to maybe take off time from work to get them from school and get them to a therapy appointment. They might have some like at-home family language barriers, or even parents who might be hesitant to engage in a therapy process, but working with the school helps them maybe get on board or a little bit more comfortable with that.
So there's about 700 kids in the Growing Through Grief program. 77,000 kids in Minnesota will experience the death of a parent or sibling before they're 18. So it's sort of been this quiet crisis, and people don't like to talk about death. It's a hard thing to discuss, and a lot of us don't know what to say in those situations. And so Growing Through Grief helps kids build resiliency and be able to go through the benchmarks in their developmental lives in a positive way, instead of getting into negative behaviors, which is a common outcome of.
Is it something where teachers will recognize the students who might be going through grief and connect them to grief counselor?
Teachers will refer kids. Sometimes parents can refer kids. Sometimes our pediatricians will understand that the child is going through this situation at home, and they can refer the child into Growing Through Grief. Any school that has this, and Burnsville districts 191 and 196, Prior Lake, Savage, they have these programs, and they have grief counselors that work in those schools. So anybody really can refer a child.
Do you work with schools when there's shootings or kids are processing those type of emotions?
Yes, that's the third modality that Growing Through Grief works. In grief groups, which is most of the work, individual counseling where needed, where appropriate, and then crisis support. So, for example, Richfield had a shooting last year, and that was pretty traumatic for the school district and everybody who worked there and the school families. And so our grief counselors would reach out to help those students, those families, or the school staff. In St. Louis Park, just a school that's 2 blocks from my house, you may remember in 2012, I think it was, there was a horrible accident on a field trip over in St. Paul, and 2 kids lost their lives. And our grief counselors from the whole program were over at that school when those buses came back from that field trip to help not just the families and the students who needed support, but also the school administration and the leadership. And how do they deal with this? How do they navigate this horrible crisis that happened to their school community?
What advice do you have for young people who are struggling with mental health? What advice would you give them? What advice would you give their parents?
Cool thing to do with your kids every day is every kid walks in the house from school and you say, how is your day? And they say, fine. And what I like to say is, fine doesn't mean anything, right? Fine doesn't tell us a lot. So what I really like to encourage parents to do is, if fine is the answer, to kind of say, hey, can we pick a different word? And to kind of just allow them the space to, even if they just say good, right? Or maybe they just say okay, or maybe they say bad and they don't tell a lot more. But to kind of invite them in a different way to share about, their day, the things that are going on in their life, and to kind of press a little bit more beyond that fine, because somewhere along the line, fine just kind of loses its meaning.
We have been put into this world where we can access information about whatever we want, whenever we want, right? We can have the news on 24 hours a day and take in all of that stuff. There's a temptation to be online a lot, right? And especially like social media, all of that stuff. And what that ends up doing, I think, is it takes you away from what's going on right now in your life. So what I encourage, especially teens, but also parents and kids, is to take screen breaks, right? Or at least take breaks from the news and from social media so that you can experience your life as it happens versus always kind of looking out for what's going to happen in the future or what just happened, in a different area. It's good to be informed for sure. But it's also good to give your brain a break and to go out and experience the world and your life as it happens.
For personally speaking, for kids and adolescents, what I recommend is to just be honest with parents, no matter how hard it might be. I understand that if you do not tell your parents that you are struggling, they cannot help you. And I feel as if there are a lot of situations children are pressured to keep their mouths shut on their mental illness if they're dealing with family issues. But the more that you feel like you have to stay quiet is the more you probably need it. And for adults, I recommend to just try to pay attention to your kids. If there's severe adversities in their life, they might be taking it well on surface, but you never know what's going on in their head. And I recommend getting them therapy to prevent any issues, either adulthood or adolescence.